I often tell my students, you might not want to begin a therapy session by asking, "How are you?" Or even more so, "How was your week?" I mean, I'm sure I do it sometimes, at the very least in the hallway as a social nicety. But the problem with asking that question upon sitting down is that it invites the client into storytelling, and storytelling is not especially therapeutic. Simply describing how your week went, or even reporting on whether you were in a good place that day, is not equivalent to doing deep exploration, nor necessarily helps it to begin. So how then do we use the first moments in therapy to set up deep, impactful work to occur? Well, you can take some initial steps at the beginning of therapy to develop something called therapeutic focus. How to do that will be the topic of this video. So let's dive in. How we approach the first few minutes of a therapy session matters. It's like we can either telegraph to the client, this is a place just to chit-chat, which takes the conversation in one direction, or it's a place we're really going to collaborate together to do some pieces of focused, intentional work. I've had so many clients come to me, and when I ask, why didn't you stay with your previous therapist? They would say, well, they were super nice, but they really didn't do much. They sort of just nodded, maybe reflected things back, and I guess I wasn't clear what we were even doing. Maybe I wanted them to be a little bit more active. What these clients, I think, were saying is that they were wishing their therapy work was more focused. The truth is, a lot of therapies get stuck in this sort of meandering flow. Maybe there is topic switching or storytelling, such that it would be hard to pinpoint what was actually accomplished or even tried to be accomplished in any one session. Now, admittedly, approaches like CBT or DBT or solution-focused therapy are less vulnerable to this because focus is more baked into the model. So that is their advantage. Of course, the disadvantage is that they don't work with the whole mind, but mainly with its surface conscious layers, which is why I tend to be more interested in depth approaches. However, traditional depth models have historically failed at focus. Until one day came along experiential approaches to therapy, which are unique in that they do depth work, but in a focused way. The truth is, focus is much harder to do when you are going deep, but all the more important. The inner mind is so complex, and it is easy to get lost. Trying to do depth work without focus tends to be ineffective because you actually can't work on the whole mind at once. You can only work on one specific piece at a time, whether that be around exploring an old belief or learning, or working through an unprocessed emotion, whatever is underneath the place we're getting stuck. In the previous videos, I explored what I mean when I say, getting to the root of the issue. And while there are a lot of techniques required to do that, a lot simply has to do with slowing down and staying focused. If you don't stay with one piece you are tracking long enough, i.e. stay focused on it, you simply can't do all the steps required for deep healing. Now, if you've watched any of the videos leading up to this one, you'll know that I think using mindful awareness in therapy is really important. After all, mindfulness is the act of focusing in a way. But for mindful focus to become therapeutic focus, it needs a direction. It's like if mindfulness were a flashlight of awareness, therapeutic focus is the ability to turn that flashlight toward a particular place, i.e. toward the piece of therapeutic work you are wanting to accomplish, and staying there long enough for the work to actually occur. I think what happens frequently is that people maybe touch on a lot of areas, maybe even with some mindful curiosity, but then fail to linger with them long enough to end up making any real progress with any of them. So it's the therapist's job to hold things steady so that the client can continue exploring one spot without jumping around. When it comes to depth work, slow is fast. I know this is a video simply on how to start therapy work, but the idea of focus is just important context here because if focus isn't set up right at the beginning, and by beginning I mean both during the intake as well as at the start of each session, then it is harder to redirect there later on. So if you're wanting to work in a way that is deep, but also not get lost in the woods, where do you start? Well, with a symptom or presenting concern. This is really the only place we can start because it is what the client is aware of at the beginning. However, unlike most major forms of therapy where the symptom remains the focus in an ongoing way, so that it can be managed and regulated, here we just use the symptom more like a flag in the ground telling us where to dig. It's like our clue that there is something underneath, something held in the deeper brain, you could say an implicit memory, that is creating the symptom. And if you can locate that, and work to create a deeper shift, then the symptom will resolve on its own. That being said, knowing the symptom is essential, but only inasmuch as it allows us to narrow our scope. Again, it's like our clue, there is something deeper here that is worth exploring. The other good thing about starting with a very clear target symptom is that not only does it give the work a lot of focus, it ensures you're focusing on what the client actually wants to change, what matters to them, rather than based on the therapist's agenda. Now, usually the client begins to name what they want to work on in therapy in general terms, maybe using a label like insecurity or perfectionism, social anxiety, difficulty setting boundaries, right? But those labels still don't tell us a lot, mostly because people use them so idiosyncratically. So in the beginning moments of therapy, we want to get a bit more detail about how the symptom shows up. What does it look like? What are they doing or feeling when it's in full force? I think of it a lot like getting the operational definition. In addition, it's important to get just a bit of context in terms of the when and where. Does the symptom pop up during certain situations or with a certain type of people, like authority figures perhaps, right? Did the problem recently arise or has it been happening for years? What are the triggers? Now, usually that just takes, 10, 15 minutes. Not always, sometimes it takes a whole session or more. But it is important not to skip this step because you need a clear sense of exactly the issue at hand, or really issues, because there may be a short list of concerns the client is wanting to address, right? This is called contracting, where you're agreeing on what piece of work to focus on in therapy. And while it certainly needs to happen during the intake, it actually needs to happen very briefly at the beginning of all subsequent sessions. Why? Because one, there may be more than one issue, so you need to decide clearly what piece to focus in on that day. And two, even if there is just one issue, it is easy to lose sight of it and begin using therapy simply as a place to vent. And when you confirm with the client at the beginning of each session where to focus the work, it's like a chance to recommit to and reorient toward the work and get on the same page around, hey, this is where we're wanting to explore. By the way, when you're identifying the clinical concern or area for focus, it is important to remember that if I'm the client, it needs to be my own personal issue I'm working on. In other words, I can't use therapy to work on my wife's issues or my friend's issues. We can't really change other people through our work. They aren't even in the room. Now, I realize the world is often a messed up place with very difficult people in it. So if someone needs to be heard in their feelings about that and empathized with, absolutely. In fact, that might lead into some very focused work where they're exploring how to move through emotions that their external situation is bringing up, and learning how to be able to care for themselves in the face of those stressors. That being said, if someone came to me wanting to talk about how difficult their wife is to live with, I might start with empathy, but I'd also want to move in the direction of clarifying something in the client's response they want to change. For instance, maybe they find that they absorb their wife's bad mood, or they don't know how not to take it personally. Or maybe they pinpoint, hey, I'm not asking for what I need, or setting a boundary. Or maybe my partner is bringing up old trauma stuff somehow of my own, and I want to do some healing work there. Or if it really is just a toxic relationship, maybe I want to explore why I'm not leaving. In other words, for therapy to be most effective, we need to help our clients identify something within themselves that they want to shift or heal or work to develop. Now again, this is all in the context of wanting to do deep healing work. So I just want to acknowledge that we don't always need to choose that path. For instance, if someone is actually lacking external resources that they do need and that you could provide or point them to, it might be more appropriate to put on your social work hat in that case. It's kind of like a hierarchy of needs issue. Or if someone is just wanting supportive counseling and we're comfortable giving that, that's okay, as long as we aren't just going there by default. And that's why I'm making this video. Because I think sometimes we therapists just take a more passive stance by default, where we follow the client wherever they take the session. But if you're wanting to do deep inner healing work around older wounds and how they've impacted our way of relating to ourselves and others, which I think most therapists at least want to be able to do as an option, then it is really a shift in mindset and requires the client be very clear around what particular inner suffering, whether it's a depressed mood or a dynamic, like maybe being hard on themselves, that they're wanting to be freed from. Again, because once we have the symptom, then we can be curious around what is underneath. And once we've identified and begun working on that chosen issue, then it's helpful to keep that thread going from one session to the next. Coherence therapy has a really interesting way of accomplishing this that I just want to share to give you an idea of what it might look like. At the end of every session, a coherence therapist will actually write on a flashcard what was uncovered during that session, what is known now that wasn't known before, and then they have the client read that card every other day until their next meeting. So in coherence therapy, which is sort of like the paragon of focused depth work, you even have the client stay focused between sessions. There are actually some deeper reasons for the use of the card, but one advantage is it allows you to return to the contents of the card at the start of the next session so that you're picking up right where you left off without losing any momentum. Now, you don't have to do that in such a formal way, but even just reminding the client of what was discovered last week and asking if they'd like to pick up there is one way to maintain clinical focus from one session to the next. I've even heard therapists say, "Is there anything preventing us from continuing the work from last week?" That way, if something really important happened that needs to be addressed, it can be. But then it's like purposely putting on hold the previous work rather than forgetting about it so that it can be picked up as soon as this new piece feels resolved. Okay, so moving back to how to start focus work. Once you have a general outline of the issue and how it plays out, in pretty short order, you want to ask for an example. You could ask for a recent example or just one that stands out as a really clear example. Once the client has thought of one, you want them to revisit it as if they are walking through it again. The hope is that the memory will come alive a bit. You could even have the client describe it in the present tense. Like, okay, there I am. My brother just started walking my direction. Okay, I'm already feeling anxious. I cannot say enough about the power of working with examples, especially when working experientially. It's not the only option, of course. In fact, in IFS, they have their own specific steps to opening therapeutic focus, called the 6 Fs, which I'll try to make another video about. The 6 Fs are a more somatic way of focusing on and beginning to flesh out something specific. But even if you are practicing IFS specifically, it can be wonderful to start with an example. The advantage of using examples is that they give you a real, alive moment to work with, rather than just intellectualizing or talking about things theoretically or in the abstract. Additionally, when you are working with an example, it allows you to linger, slow down, get curious so that the deeper mind can speak, not just about life in general, but about what is going on internally in that moment, the moment where the issue plays out. You want to use the example almost like you would a clip from a movie, where you can now pause, slow down, rewind, look again. Now, most often you might be using an example from the past, but sometimes the best example is one that is playing out in the room, in the very moment. We call this working in the transference, and it refers to some interesting dynamic playing out live, with the therapist or in relation to the work. For instance, perhaps the client finds themselves suddenly not wanting to answer a question or feeling anxious that perhaps the therapist is judging them. We can use these live examples just like we would ones from last week, where we attend to it like we would a video reel. Okay, so let's rewind. A moment ago, I said X and something shifted between us. Let's go back. What was happening inside you in that moment? With questions like that, you are beginning to invite a type of awareness or inner listening that is almost like a mindfulness practice, where you're just noticing without judgment. But again, it isn't just general mindfulness, it's therapeutically focused mindfulness. It is the chance to mindfully attend to what was happening in one's inner mind right in the moment of the symptom or concern. Through this type of slow exploration, the client finally can have the chance to become aware of how their mind was processing things, particularly in moments that cause them difficulty. The truth is, in the actual moments of life, we rarely have the time or bandwidth to truly notice or observe ourselves. That is especially true when it comes to our deeper levels of consciousness, the more implicit or less conscious processing that is happening under the surface all the time. This lack of self-awareness isn't because we aren't self-aware people necessarily. It's just that most of our brain's processes are actually designed to sort of happen in the background, really just for efficiency's sake. But that just means it takes a little longer for the deeper parts of our experience to emerge into awareness. That is what is so great about using an example, because we can pause time. And doing so allows us to bring a deep level of presence and awareness and curiosity that of course would have been impossible to have available in real life, like during the actual moment our issue is activated. So let's say a person is exploring their pattern of always saying yes when their boss asks them to stay late, even when it really costs them to do so. That is the issue they are wanting to address, not setting boundaries with boss. So after asking the client to bring the example very vividly to mind, you might say to the client, so let's stay with that moment. Okay, so slow that down. Your boss is at your desk. She just asked you to stay late. What is happening in your thoughts or feelings or body? What's going through your head internally that no one else can see? So here is where the exploration of the mind begins. Everything I've said so far is just to clear the path and set up this moment to happen. This moment where the mind is poised to be revealed or explored. But how you approach that exploration will depend on your model. Everything I've said up until now is pretty general. It's like working to create the opening by way of finding a piece to work with and beginning to come in contact with it and bringing it to life. But in terms of the next step, which is to really discover and organize the unconscious elements at play with this particular issue, well, there are many options around how to do that kind of discovery work. You could map out what parts of you are being triggered by this interaction with boss, like an IFS therapist might do. In that case, you might say something like, so see if you can just connect to the part of you that feels scared of saying no to your boss. And if you will, ask that part what it is afraid would happen if you said no. Or if you're using some more emotion-focused model like AEDP or ISTDP or emotion-focused therapy, where you assume some difficulty with emotions might be part of this conflict or stuckness, you might ask, okay, so there you are with your boss standing at your desk. What are you feeling towards her? Or if you're doing coherence therapy work, you might say, okay, so complete the sentence or just let it complete itself. I better not say no to my boss because if I do. So the point here is that there are many ways to explore the unconscious mind and see where it gets tangled up. In other words, to really map out what is happening under the surface that is causing the person to have a less than empowered response. However, while there are many options for how to track the mind, you do need to have some clearly defined way. In other words, it's really essential to have a framework or model to guide inner exploration. Otherwise, even if you set up therapeutic focus at the beginning, it will be hard to maintain through a whole piece of clinical work. That is what a model is useful for. It helps the work stay focused and organized all the way through. To summarize, this particular video has been all about finding the path into the woods, if the woods is the deeper mind. You need a clear entry point, what in IFS they actually call the trailhead. Without that, the session is likely to just stay with storytelling or get stuck on the surface. However, once you have the trailhead, you can then use an example, or possibly some somatic awareness if you prefer, to begin to enter down the chosen path. Now, once you're fully in the woods, you don't want to get lost there either. You still need some map. In other words, if you want to keep the work focused, not only at the beginning, but throughout the exploration, it is really important to have a framework. And that is where mastering at least one experiential model of therapy can be so helpful. If you'd like to learn about some examples of experiential therapy, so far I have a series on AEDP, IFS, and coherence therapy on my channel, and they would be a good place to start. By the way, you can find any of my series by going to my channel, but instead of looking under videos, look under playlists. This video is actually the last in a whole series on experiential therapy, although perhaps I'll add more to the series over time. In any case, I hope what I've shared so far brought to life what is so beautiful about the experiential movement. We talked about the rich, organic history that led so many therapists across various camps to work in a more experiential way, how so much of that had to do with the incredible science around attachment theory, not to mention the power of mindfulness. We explored the science of why these two elements pave the way toward transformation by supporting the brain's innate capacity for memory reconsolidation. We even reviewed the various techniques you might use to allow both safety and mindfulness to come online and how to use them in a focused way. That was a lot to cover, and I so appreciate your staying with me until the end. Thanks so much for watching. I just want to mention our Patreon community is really taking off, and I've been so enjoying getting a chance to know so many of you guys. If you would like to join our community and join our conversations, please check out my Patreon page.